My friend, as we continue in this journey of fighting cancer, I want to share the main diagnostic tests that are done depending on the type of cancer. Number one being barium enema. These are procedures used to test the health condition of a rectum and a colon. Number two, we have biopsy. Biopsy, this is where a tissue sample is taken from a cancer patient or any patient, depending on the condition of his health, to diagnose the cancer. It can be taken a small part, that particular tumor, blood, and taken to the lab for cancer test. Number three being bone marrow aspiration and biopsy. These two procedures provide the information about the blood cells. More information about the blood cells. This is where you can learn, okay, according to what I learned, blood is manufactured or produced in bone marrow. So, this is the right place where they get the information from the test done to determine whether the patient has cancer. We have something else, number four, we call it bone scan. Bone scan, this is where it is done after treatment, where it is tested to determine if the treatment is working. We call it bone scan. After being treated, maybe by, okay, we'll come to this point later. Once a cancer patient is treated, there are various ways to treat cancer, and depending on the stages and grades, once the patient is treated, to confirm, a bone scan is done to determine if the treatment is working. Let's go to point number 5. We have this testing of breast. We use breast MRI. This imaging test is used to check the breast tissues if the tissues are cancerous. We go to point number 6, or test number 6. There is the colonoscopy. Colonoscopy is done via the behind, we call it anus, where this test is used to determine the health of the large intestine. We call it colon. And the procedure itself is called colonoscopy. This will determine the health of large intestine through anus. We go to point number 7, or test number 7. We have what most people know called a CT scan. In the right language, it is known as computed tomography scan. Computed tomography scan. This type of imaging test is used to find and learn more about cancer at a particular part of the body. Maybe you can say the head, the chest, So this kind of diagnostic test is done. There's also another one, digital rectal exam. This one is used to check the lower rectum, pelvis, and lower belly. It is used actually to test that particular part, the pelvis, the rectum, and the lower belly. We have another one, we call it electrocardiogram, EKG, and echocardiogram. There was a time it was done to me in India. I know it. These tests the problem with the heart muscles, valves, or rhythm. It is also used to determine the cancerous parts. If some of these parts are affected by cancer, it actually detects. It's one of the diagnostic tests for cancer. We have endoscopy. Most people know endoscopy. This is a scope where it is used through the gut, the GI. We call it gastro. It goes through the mouth, through to the stomach, to determine if there is cancer, growth, ulcers, and also the health of the stomach or the gastro. We have another test that is known as fecal occult blood test. It is used to determine the cells in a blood. I'll come to explain later about fecal occult blood test and how it is done. We also have magnetic resonance imaging or MRI, X-rays. Without X-rays, this has no X-rays. Magnetic resonance imaging, MRI. Imaging test done without X-rays. We have another one known as mammogram. This X-ray that checks for breast cancer. Mammogram. We have another one, MUGA scan. MUGA scan. We call it MUGA scan or MUGA scan. This is used to test for checking if the lower chambers of heart are pumping blood properly. It is good to know these types of tests done. We also have another one known as pap test. You hear some women saying that I have to go for pap smear and all that. We have this pap test. This is a procedure to find changes in cells that can lead to cervical cancer. We have another one, positron emission topography and computed topography, PET-CT scans. PET-CT scans, most people have had this, used to find cancer and learn its stages. This one will determine the stages of the cancer. We have another one, sigmoidoscopy. Test to examine the lower part of the large intestine. Another one, we have tumor marker tests. Types of tests that look for substances made by cells in the body in response to cancer. We have another one, ultrasound. Most people knows about this. Imaging test that can show tumors location in the body. We have another one, upper endoscopy, used to examine the esophagus, stomach, and top of the small intestines. For now, we have these ones, and it is good. You should learn each step by step. Let us continue with this journey of fighting cancer. Next, we shall have cancer stages. Kindly look for these videos, and it is good to learn what to be done. Thank you so much. Enjoy the education and the videos. Thank you.